Hello, my name is Laura Castle, and I'm a student in the Psychiatric Mental Health Nurse Practitioner program. My topic for the poster is narrative exposure therapy for post-trafficked, post-traumatic stress disorder. A lot of posts there. I'm going to enlarge my poster just a little bit so that you guys don't have to be straining to see what I'm talking about. We're going to start off with the background and significance. Human trafficking has been declared a public health emergency affecting 12 to 30 million people globally, and also 5 million of those being children. Human trafficking includes pimp control, commercial sex, exploitation, forced labor, modern slavery, and child labor. These victims need identification, connection to relief services, and treatment for medical and psychological conditions. 28 to 87% of trafficked individuals interact with the healthcare providers while being exploited. So advanced nurse practitioners, they can be a key in being able to identify these victims of human trafficking and help to connect them with the evidence-based care that we want them to be able to receive. Next, for the proposed intervention and supporting evidence, first I want to talk about my intervention, which is narrative exposure therapy, abbreviated as NET and called NET a lot. It's a clinician-patient co-recreation of the patient's lifeline, facilitated and recorded by the clinician. And there are multiple levels of support for the use of this type of therapy with victims of human trafficking or people that experience multiple traumas. The first article I'm going to talk about is Brady et al., and it tested the feasibility and outcomes of NET in human trafficked survivors with post-traumatic stress disorder. The assessment tools used were the CAPS-5 and the PCL-5, and the ANCOVA results of the data showed large effect sizes, resulting in a magnitude of change in those PTSD scores compared to the baseline scores that were taken. There was a 95% confidence interval, which indicates a strong significance, and 50% of NET intervention, that treatment group that received the NET intervention, experienced a decrease of their post-traumatic stress disorder symptoms that they were experiencing. Schroeder et al., it analyzed the interventions for human trafficked survivors across a multitude of studies and showed a large effect size on PTSD. It was statistically significant in its outcomes. And then the last article that supports this intervention is Williamson et al., and it explored the lived experiences of human trafficked survivors with moral injury. It identified emotional trauma, trust issues, and barriers to care, and highlights the need for trauma-informed care like the NET that I presented, and provide individualized support for each victim. The synthesis of this evidence includes NET is supported by strong quantitative outcomes that does align with the survivor experience that you see in that qualitative study. The gaps include small sample size, lack of NET qualitative research. I searched trying to find one specifically that showed NET. The only one that I could find that specifically with NET and victims of human trafficking was it was a dissertation, so I couldn't use that. So that could be a little bit more researched. And it's also gender diversity is lacking because most of the victims were female. The theoretical framework that I chose was Paplow's interpersonal relations theory. And Paplow observed that even though nursing can consist of implementing technical interventions, the nurse-patient ratio the nurse-patient relationship is essential to providing quality care. The premise of this theory involves a continuum of the nurse-patient relationship throughout the time of care. So as you can see, I related that to my project as the nurse to trafficked victim roles that we may see. So we can take on the role of a stranger. So when we initially meet them, we'll be a stranger. Then we're going to be a resource to them. We're going to be a teacher to them, a counselor, a surrogate, and a leader. So whenever you open the poster, you can look a little closer at those roles. The implementation plan includes as step 1, project organization. We're going to meet with the stakeholders. We're going to gather the project team. We're going to assign roles and responsibilities to each member. Step 2, we're going to do our recruitment phase. We're going to pull in our community resources there, our primary care providers, mental health professionals, and local outreach programs. to be able to identify people for our study. We're also going to hand out flyers in the community, maybe possibly put them up in different school locations so that we can reach the parents of the community that may be struggling with this. Step 3, screening and informed consent. So it's a vulnerable population. So we need to be very careful and make sure that we do get an adequate informed consent, make sure that they're not too traumatized to be able to receive that therapy at that time. And we're going to assess that they actually do have PTSD with the PLC-5 and the CAPS-5 as they used in the other quantitative studies that I showed as support. Step 4 is the pre-treatment phase. So everybody's going to receive one session of psychoeducation before they initially begin the NET therapy, as a way to help them, know what they're going to expect and make sure that they're ready for that process. Step 5, the NET treatment delivery is going to happen. There's going to be 14 sessions of NET therapy given, lasting 90 minutes each, conducted bi-weekly. The participants are going to be paid for their travel experience, not for their travel expenses to reduce any barriers in participation. We're also going to supply them with a journal to be able to record their thoughts and feelings concerning therapy so that we can get that qualitative aspect as well. What else? Okay, we're going to make sure our trained medical professionals have the proper training. They know what they're doing with the NET therapy so that therapy can be given in a professional manner and be effective. We're going to provide flexible scheduling, maybe work even weekends and after in the evenings to accommodate and also encourage participation. And then step 6 is our assessment, follow-up, and dissemination. We're going to re-administer that PLC-5 and the CAPS-5 at project midpoint, completion of treatment, and 3 months post-intervention. And then we're going to present our findings. Let me see if I can speed this up a little. And I cannot, it won't go, but you can actually see it here. But we're going to present our findings to, I cannot get that to go off. We're going to present our findings to our committee that we set up, our community stakeholders. We're going to present it at medical conferences. And also we may add that on social media so that the general public can also benefit from the results of this information in this study. Here's my Gantt chart. It's NET post-trafficking Gantt chart here up here in the right-hand corner. The first 3 steps are going to be completed in weeks 1 through 3. So our screening and our informed consent gathering are going to happen there. Week 4 is when we're going to do our week of psychoeducation. Weeks 5 through 11, they're going to receive the actual NET therapy. And then week 8, we're going to do our midpoint reassessment, reevaluation with those tools. And then at the end, we're going to reevaluate the PTSD with those screening tools. And we're also going to disseminate our evidence there. The last section of the poster talks about outcome measures and just gives a definition of the difference between the PLC-5 and the CAPS-5. PLC-5 is a self-report questionnaire, whereas the CAPS-5 is clinician administered. So it might be a little bit more effective because the clinician can help guide them through and help them rate their response to each question more effectively as they assist them with that, filling out that form. Screening administration and score comparison analysis. We're going to do that. I already kind of explained that we're going to do that at initial screening, and we're going to compare those scores at project midpoint, completion of the treatment intervention, as well as 3 months post-intervention. Also, my references are listed here, and they will also be uploaded with my presentation for you to get a closer look at the references if you want to reference those articles. It was good to, I don't actually get to see you, but I hope you enjoyed the presentation and it's given you a little bit of food for thought. And if you ever have to deal with victims of human trafficking, hopefully this research will help you. Thank you for your time.